about what is diabetes, what are symptoms that may be diabetes, and how do I feel, and what can I do at home to see if I have it, and what are symptoms that I need to be controlling. What I'm going to do here in a little bit is I'm actually going to bring a patient over. She's agreed to actually let me check her blood sugars, but let me just discuss for a second, what is diabetes? In my opinion, my medical opinion, it's one of the worst conditions that you can actually be diagnosed with because it doesn't respond in one person like it responds with 2 or 3 other people, okay? So there's certain foods that you get, certain foods that you eat, there's certain things that you do that affects one person more than it affects the other, okay? So what is diabetes? Diabetes is essentially hyperglycemia, okay? High blood sugars. So it's your pancreas. Your pancreas is located mid-abdomen here, okay? And so what your pancreas does, it releases both sugar as well as insulin into your body. It's a consistent feedback loop. It does sugar, it does insulin. Your sugar gets too high in the system, your body should be releasing insulin out to control the sugar level. If you haven't eaten and you're fasting, for example, your insulin level will begin to be higher in your system because you haven't eaten anything, your sugar goes lower. Your pancreas actually throws insulin out into your body. And so it's a constant averaging back and forth of keeping your body status quo, okay? So what is diabetes? Diabetes is your pancreas is not controlling your sugar levels. Now, you can be born with diabetes, type 1. You can be diagnosed with diabetes, type 2, and this is usually due to bad diet, lack of exercise. And women who are pregnant are sometimes diagnosed with gestational diabetes. Gestational diabetes is something that is not being, your pancreas in your body is not controlling the sugar and insulin levels because of the baby, because of the hormone levels. In most cases, once you give birth, and again I say in most cases because not always, most cases when you give birth, the gestational diabetes goes away, and there usually is no risk for the child and no risk for the mother later, okay? So let's just take one step back for a second. Remember, like I just said, your pancreas that is regulating the sugar and insulin levels, you can have what's called hypoglycemia, or low blood sugars, or hyper blood sugars, okay, or hyperglycemia, all right? And that's what we know as diabetes, all right? Now, some of the questions that I've got are, what symptoms in particular should I be feeling or do I feel, and is that a concern for diabetes? So we're all aware that when we're hungry, what happens? You're usually angry, upset, anxiety, stressed out, and then as soon as we eat, you feel a calming sensation to your body. You may not think about it, but it's what happens, and it's the reason why when, in fact, there's a joke about, the woman, she's angry, feed her, right? Well, granted, a little bit of a not so smart joke, but there's a little bit of truth to this in the medical community. And it's not just women, it's men, it's kids, it's everybody. When somebody is hungry, their sugar insulin level is off, which plays a role into the hormone level that we have in our body, and that's what creates these feelings, okay? Now, real quick, before I bring her over and we test her blood sugar, what are some of the things that happen if you are diagnosed with diabetes? And here's the reason why I wanted to go over this with you, because as much as I like to be upbeat and go over things with people so people understand, diabetes is a serious situation. And people who are diagnosed with diabetes or have a consistent high blood sugar, also known as prediabetes, are at risk for heart attack, stroke, atherosclerosis, which is hardening of the arteries. Your stress level is usually higher. You usually don't feel good. You also have concerns for eye problems or loss of vision or complete blindness. A pretty common symptom is you have your nerves in the bottom of your feet or in the bottom of your legs. The nerves actually, you start becoming numb, okay? And so you notice numbness and tingling in your toes or the bottom of your feet or in the bottom of your leg areas. Sometimes in the fingertips it occurs as well. And so you've probably heard people who have diabetes oftentimes, if they don't control it using medication, herbal remedies, or both, as well as diet and exercise, they usually have to go through amputations. And so then you end up losing your foot, your leg, your arm, things like this, okay? So let's bring her over here for a second. And I have a patient who's agreed to test her blood sugars. And if you can come on over here, and thank you so much. Okay, guys, so what I'm going to do is I want to show you exactly how to accurately and clean check your blood sugars. And when I say clean, I'm saying that on purpose because and this actually makes a difference. So let me just go over the things that you're going to need, okay? So the first thing, you're going to, and I'm using just somebody's hand here as an example. You want to make sure that you wash your hands really good, soap and water, dry them, let them dry, because you don't want any oils or any lotions or creams on your skin, okay? And let me go over, just before we actually do this, what you're going to need. You're going to need some sort of monitoring stick. And this is where the blood actually goes into. They look like this. They're really small, so if you can get a little picture of that. Sorry, it's a little hard to see, but you can see how small that is. You're going to need that little monitoring stick. You're going to need a form of these. And it doesn't matter what brand you're using. These are just a form of a needle that you can either, when you take this off, you can hand stick yourself in the finger, or they sell also for about another $7 to $15, another unit that you can set this into, and it essentially just pops down and pricks the finger. And then you will need a glucose monitor. And they usually look like this, different colors, different sizes, but essentially they're small, and they usually come with some kind of little compact design. Now, here's what you do. So again, you've washed your hands, you've cleaned your hands. There's no lotions, no alcohols, and that's important. You can't have a dirty hand. You can't have alcohol in your hand or any kind of lotions or creams, because that will alter the blood sugar level. Now, what you're going to do is you're going to pull this off so that you got that open. Here's your little needle. What you're going to do is this monitor, once you stick this in, now, let me show you this. On this side here, this is actually what goes into the meter. And this side here that has the little silver plate, or a little electronic plate, which is kind of hard to see, that's actually what the blood goes into. And the blood is going to feed through here and go into the meter. So what you do is you first, there's a small hole on the edge of these meters, and you are going to stick this into the hole. And you got to kind of push it in there good. And that will turn the meter on automatically. You don't need to actually press these numbers. Set this down. And now what we're going to do is you're going to kind of caress the finger, the area that you're going to stick. Hold it for a second. And milk the blood from where you just stuck into the finger. And the key is that you want to make sure that you have a good amount of blood coming out, okay? Now, what you're going to do is you're going to take that blood droplet and you're going to stick this meter there so that you're touching that. And again, I'm doing this from the opposite direction so that you guys can view this. And you just want to make sure that you got enough blood on that meter. And then what's going to happen is that the meter will then give you a reading. And so on this particular patient, the number is 97, okay? And so this is 2 hours after the person has eaten. And so when you do this, and we're gonna go into, in just 1 second, what you do and how quick and how fast you monitor your blood sugars after consuming food. And I'm gonna go into that in just 1 second. And again, just recapping here, things that you need. You need something to stick the finger with, blood glucometer, and then the little coated chip that goes into the blood glucometer, okay? Now that the patient's left, let me just go into a little bit of detail of things that are important that a lot of people mess up on or miss, okay? I discussed about how you need to wash the hand, make sure there's no alcohol, lotions, and things on the skin when you're doing this, because it will alter the result. It doesn't alter the result 10, 15 points, but it will alter it a little bit. And if you are concerned about diabetes or you have gestational diabetes or type 1, type 2 diabetes, you need to be careful on your numbers because it does make a huge difference each and every day as you're doing this. Now, something else that's very important to do is when you are sticking in the chip in the bottom of the glucometer, okay? This one here, and I've used quite a few of these, and they all seem to be pretty similar. When you stick that little chip into here, really get a good grip. Get it in there good so that when this turns on, because sometimes this will turn on, and that chip is not fully in there. And I've realized that it seems that alters the result just a little bit as well, okay? Now, when you have your blood sugar levels, okay, what do you do with them? Now, if you can just zoom down here for a second, what I did was I typed out a blood glucose log, all right? Now let me explain this to you for a minute. Here's how this works, and it's really easy. What I did was I separated this into day and date, fasting, so your goal should be less than 95. Then you have your breakfast. You write down what you ate. 2 hours after you ate that meal, you're going to record your blood sugars, and this is what I just went over with you. Then your lunch, again, goal is less than 120, write down. 2 hours later, check your blood sugar. And then dinner, same situation, okay? So the bottom line, guys, is that we want to make sure that you are sleeping 7, 8, 9 hours, okay? Because the first part of this is when you're checking your blood sugar levels, the very first thing you do when you wake up in the morning, before you drink water, before you drink coffee or tea, before you eat anything, you want to first check your blood sugar levels and write this down on your fasting goal, okay? So the very first thing you do on this is you write down your number in the morning before you've done anything, right when you woke up. Then when you eat breakfast, for example, you eat, 2 hours later, you're going to recheck it, okay? So in other words, after breakfast, after lunch, and after dinner, you're writing down everything that you ate, and then 2 hours later, you're rechecking your blood sugar levels. Now, come back down here for 1 second. Now again, this is a clear piece of paper, and I haven't written anything down on here. But what you want to do is that under meals here, don't just write down here, I had eggs, and I had bacon, and I had toast, and I had coffee, and I had orange juice. Write down every single thing that you ate. If you ate 3 grapes, write it down under the meals, okay? If you drank water, but you took if you drank half a cup of green tea, for example, write it down. So under the meals section, this does not include only what you ate. It includes what you drank as well. And it includes anything you snacked on before or in between your breakfast or your lunch and your dinner. Because those little things, a half an apple or some grapes or something that you drank, is going to alter your blood sugar levels, okay? And if you, for example, you eat lunch, you should be waiting 2 hours before you're going to then monitor your blood sugars. If you snacked on anything in between your lunch and when you're going to monitor your blood sugars, it is going to throw off your number, okay? Now, last thing I'm going to close this with is that, again, diabetes is one of these situations where if you are person A and you eat pasta, for example, most people, if that has diabetes, pasta is going to throw your blood sugar levels skyrocketing high, okay? But there are certain foods that person A can eat it, and person B can eat the exact same amount of that food, and person's A blood sugar levels are going to be higher than person B's, okay? And this is the reason why the blood glucose log, or the diet protocol, or whatever you want to refer to this sheet as, it's a little bit of a pain in the ass, to be honest, okay? But it works, because when you write down the things that you're eating and the things that you're drinking, and then you check your blood sugar levels 2 hours later, and you have a week, 2 weeks of this stuff, anytime on this sheet, when you look at your blood sugar levels, and that number is higher than the 120, go back and look at what you ate for breakfast, lunch, dinner. Circle foods that start to stick out. because every person that has diabetes has certain foods that are going to make your blood sugars really, really high, and other foods that most people can eat that don't affect blood sugars very much may affect you. Okay? So that's what I want you to really be doing is check your blood sugars, use these logs, and you can copy mine if you want and print it out on your computer. Go to our website, go to our information. We have these here for you. But circle the foods that are causing you guys problems, because this is how you're going to control your diabetes. Okay? So I'm Dr. Joe Brown. Remember, your health is in your hands.